So the next point we're thinking about is like, is it really right for everybody to have a reduction surgery, or what are the pros and cons on that? And like, is it a cure? Because I don't know. I mean, to me, if you have lipedema and it is in your body and you have it removed, but it grows in all these different times of life, is it gone, or is it just like in remission potentially?
So yeah, that is what a great question. And so again, lipedema is a systemic disease. There
That's
are
why it's called a chronic illness.
yeah, chronic illness, and so there are metabolic and lymphatic changes, and we're now seeing the genes point to our genetic information now points to some signaling proteins, even possibly in the vascular notch signaling proteins that may be involved in lipedema. So this is all over your body. It's not just in your legs; it's in your arms. Trunk and so so you cannot cure that with just a surgery. Even if you had surgery all over your body, you still have the lipedema genetics and milieu. So it has to be managed lifelong, and
So we always have the predisposition.
that's right. Yeah.
Okay.
Now, to your point, does everybody need surgery? No. The answer is no. Many people can manage this with diet. I really like to point towards some papers published by Dr. Amato, and he has had great results. He does surgery, but he surgery only for those who need it.
Further,
Yeah,
like
for further
further,
reduction,
further
further.
reduction
Yeah,
or further benefit
yeah.
for, yeah, I mean, I don't know. And then, I mean, we also have to talk about, quite frankly, in my opinion, the personal choice. Like you can be, a woman with this disease, and a million people can tell you what to do. But if it's not what you, if you're not feeling it, in my opinion, you should not go into it until you're feeling it, right? You shouldn't be doing anything just because people are telling you to do it, because that's when things go awry, right? Like your head has to be in the game,
Yeah,
right?
for sure, for sure. Yeah, this is something that has to come from inside, and it also has to be, your surgeon and you have to come to it, or all your doctors or all your support have to be there for you, and everybody, and you have to embrace the plan. I mean, and you have to be ready for that. It's a
Right.
lot.
Right. And you have to weigh the risks and the benefits, because everybody has a different risk and benefit. So, like, I, at the moment, am in this, but I still am not. Um, it's not a surgery journey for me yet, because it's not clear that the risks don't outweigh the benefits. And so, um, it comes down to a personal choice. I'm a person who has had a whole life change, and maybe this is where I'm going to be. Maybe, going from a gastric bypass where I was 404 pounds to, letting go of, well, still after 20 years, I'm still down 150 pounds. So that's like, you know, an amazing
Yeah,
relief
for sure,
already,
for sure,
right?
for
And
sure,
so
for sure.
maybe for now, that's just how it is, and that's good enough for the moment. And we see if something changes later, but risks at the moment outweigh the benefits. So,
Yeah, that well said. I have, I mean, I really, uh, I couldn't have said it better. I have nothing to add.
I can add one thing. I mean, I can tell you though, I can tell you though, it is a much better journey as you're reducing uh, than as you're adding. So, a reduction journey, in my opinion, I think everybody's opinion, is always more helpful. So it's more helpful for mobility, it's more helpful for swelling, it's more helpful for state of mind, obviously. It's more helpful for, access. And oh, what a good segue. Let's talk about that. So,
Wait,
wow, we could have planned that.
We're gonna take a quick break.
Okay, we'll take a quick break. Stay tuned. We're going to talk about access when we come back.